Hello, my name is Xin Gao, and I am a postdoctoral fellow in the program on reproductive health and the environment, working with Dr. Tracy Woodruff.
Hello, my name is Rebecca Shiguru, and I'm a postdoctoral scholar in Dr. Neetha Talker's research group, the CLEAR Lab, and in the Department of Medicine at UCSF.
My name is Meng Jing. I'm a postdoc researcher in Jocelyn Group and UCSF.
Hello, my name is Ling Li, and I'm a postdoc in Dr. Robinson's lab in the Department of OBGYN and Reproductive Science.
As a member of the UCSF EARTH Center, I've been able to be part of a synergistic, multidisciplinary environmental health research community.
First, we have two great mentors, Dr. Padula and Dr. Robinson, who share their experience with us and guide us in our career development, including some very basic but crucial skills like grant application, resume writing, and development plan. I also have greatly benefited from connecting with other postdocs in the toxicology field who have various expertise, experience, and career path. We meet regularly to share our research achievements and even the struggles and difficulties we face as postdocs. Each meeting is not only a valuable lesson, but also a source of inspiration and motivation to keep moving forward.
I have greatly benefited from professional development activities, such as grant writing workshops, and also being in an interdisciplinary community with other postdocs and learning about their work.
I have great benefit from the patient guidance and extensive experience of the professors here, which have been instrumental in my professional development.
My research focused on the impact of chemical exposures on the early development of embryos and placentas. We established the whole embryo culture system in our lab for the first time. We can expose rat embryos, which are at a very early stage during organogenesis and gestation, to different chemicals. This allows us to explore the mechanism of toxicity in embryo development at morphological, cellular, and molecular levels. I hope our results will provide a better understanding of the mechanism that potentially link environmental chemical exposure to adverse developmental outcomes.
My research focuses on how structural drivers impact neighborhood environment and produce racial and ethnic health inequities. Leveraging epidemiological and geospatial methods and through an environmental justice lens, I aim to understand the ways in which structural determinants such as racism and capitalism shape the distribution of health-promoting amenities and environmental hazards, and how these processes impact perinatal and cardiovascular health.
My research focuses on the reproductive toxicity of environmental pollutants. Here I use the cell and mouse model, as well as computational methods. I try to uncover the mechanism of how these pollutants can affect the reproductive health. And our research has significant implications for public health policies as the environmental regulations. By understanding the mechanism, we can develop a way to reduce harmful effects of pollutants on reproductive health, ultimately benefiting the society and informing government actions. Currently, I'm investigating how people can affect the differentiation of placenta cells and identify the compounds that can activate the IR receptor. This work is crucial as it can lead to better regulatory measures and potential therapeutic innovations. After my postdoc training, I plan to pursue a career in academia and continue my research in the field of toxicology with a specific focus on the reproductive toxicity.
In my research, I study air pollution and other climate-related impacts on the cardiovascular and respiratory health conditions and outcomes. California communities have experienced more frequent wildfire smoke events due to climate change, and this increased rate of wildfire events has caused a reversal in the improved air quality conditions in the western US. Further, studies have found that respiratory health impacts of wildfire events have been impacting the most vulnerable communities, such as children or those who are socially marginalized. These groups already experience a disproportionate amount of fine particulate matter pollution and other toxic gases due to historic injustices in the US. So our methods are looking at identifying sub-daily exposure metrics of pollution such as wildfire smoke and extreme heat, and then aggregating these exposures with emergency department visits and hospitalization data. We hope to better understand how these climate exposure contributions to poor health in the pediatric and adult population are across environmental communities in California. In relation to this work, we've also been examining how local decision-making and climate resilience plans are on reducing the impact of wildfire smoke on our health. Crucially, we really need to understand the effectiveness of these recommendations in the local context, as that's currently lacking in the studies related to risk mitigation.
After my postdoc training, I plan to pursue a career in academia and continue my research in the field of toxicology with a specific focus on the reproductive society.
I plan to continue research at the intersection of environmental and health sciences with the goal of understanding how to best improve already existing health burdens through effective environmental policies.
I plan to pursue an assistant professor position and continue my research on racism, place, and health.